Hello Nation. Today we're going to talk about the long-term diabetes control factor. Now, many of us know it as the A1C. It's also called the hemoglobin A1C or the glycosylated hemoglobin. Basically, this is a test that measures your average blood sugar over a 2 to 3 month period. Basically, if you took your blood sugar, prick your finger every hour for 24 hours for 3 months and took an average, that would be your A1C value. But of course, that's impossible. Now, what is the A1C test? It measures the amount of glucose that's grabbed onto a red blood cell. And that's where the word glycosylated hemoglobin comes into. Now, red blood cells live in our body for 2 to 3 months. They're produced by our bone marrow and cleared out of our system by the spleen. So at any one time, if you draw blood, doesn't matter, doesn't have to be fasting, any time of the day, you're going to get some brand new red blood cells and some older red blood cells. And they measure the amount of glucose glycosylated or stuck to the red blood cells. And so we know that we get the A1C as a percentage. So for example, normal individuals are 4 to 6%, and that means their average blood sugar is somewhere between 80 and 120, because they could eat anything they want at any time, and their blood sugar should not go excessively high. Those son of a. Okay. Now, if you have diabetes and your blood sugar's been high, your A1C is going to be high. And typically, the goal for most folks is 7%, which means that your average blood sugar is about 150. Now, if your A1C is 10%, that means your average blood sugar is about 240 over the past 2 to 3 months. Now, the point of this Edelman report is to tell you that that test may not always be accurate. If you have anemia, if your blood count's low, if you just had a blood transfusion, if you have a weird genetic disease like hemoglobin or sickle cell trait, which is common in African Americans, your A1C could be extremely low, but yet your blood sugars are high. That's important to know because there are other tests that can measure the average blood sugar over a previous period of time. We have fructosamine. It's another glycated marker. It doesn't rely on the red blood cells, so we use that in situations of pregnancy or anemia to try to get an idea of what the average blood sugar has been over the prior 2 to 3 weeks. There's also a test called 15AG. It gives you an average over the past 10 days and also can give you an idea of how high your blood sugars are going up after eating. So there are other ways we measure the glycated markers. And don't forget that you can get the Bare Home A1C kit at any pharmacy and do it in the privacy of your own home with a drop of blood. When we go to the lab, they have to do a venipuncture. You know, the person in the lab, for me, it's usually their first day on the job, and they're looking for the vein, and then they draw your blood, and then they send it off to the lab. So you can get home tests, but most of us go to the clinic or the laboratory. So remember, Nation, your hemoglobin A1C tells you what your average blood sugar is over the past 2 to 3 months. It can be inaccurate, and there are other measurements that we can use to help you and your doctor know how you're doing. So long, Nation.